This presentation will focus specifically on skin cancer. Please have your syllabus next to you so that you can make notes with reference to the following dot points. With regard to the nature of the problem, skin cancer occurs when skin cells are damaged, for example by overexposure to ultraviolet radiation from the sun. There are three main types of skin cancer: melanoma, which is the most dangerous form of skin cancer but also the least common, basal cell carcinoma, and squamous cell carcinoma. Melanoma, the most dangerous form of skin cancer. Melanoma develops from the melanocytes, or pigment cells, which are responsible for giving the skin its colour. Overexposure to the sun is the most likely cause. It's also the least common form of skin cancer. And it's also the most serious due to its rapid metastases, or its ability to spread to other parts of the body. The other two forms of skin cancer, basal cell carcinoma, or BCC, refers to abnormal growths in the deepest layer of the epidermis. They almost never spread though, so they tend to stay where they are, but they can be disfiguring if not treated, so they do need to be removed. Squamous cell carcinomas, or SCCs, are also abnormal growths, but they are more closer to the outer layer of the epidermis. They're more likely to spread than the BCC, and they can also be disfiguring if not treated, so they also need to be removed. Skin cancer risk factors can be broken up into non-modifiable, or those that cannot be changed, and modifiable, those that can be altered. The non-modifiable risk factors include those that have a family history of skin cancer, those that have skin types that are pale or fair, light-coloured eyes, the presence of moles and freckles, or blonde or red hair, those that are generally a little bit older, so 50 plus, probably more likely to get skin cancer, and those that have a cancer history, so someone that's had a melanoma already is at increased risk of developing another. The modifiable risk factors include reducing exposure to UV rays, particularly between 11 AM and 3 PM, especially as a child or adolescent. Repeated exposure to UV rays over their lifetime, including solariums. This can be modified. People can reduce their exposure. Episodes of severe sunburn are a risk factor for skin cancer, and also geographic location in a high sunlight longitude. So those people that are closer to the equator generally have a higher risk. Skin cancer protective factors include avoiding sunburn, particularly in the first 15 years of life where the most UV damage can be done. Minimizing sun exposure, particularly when the Sun Smart UV alert exceeds 3, and also avoiding exposure in the middle of the day between 11 and 3 PM when UV levels are at their most intense. Avoid tanning and using solariums. And of course, apply the slip, slop, slap, seek and slide routine. So slip on protective clothing, slop on some sunscreen, slap on a hat, a broad-brimmed hat preferably, seek shade, and also slide on protective sunglasses. Another protective factor is regular skin checks, and this can be done by an individual, and if changes are noticed, then obviously seeing a GP immediately is advised. The sociocultural determinants of skin cancer include those social and cultural factors that may determine the tendency for someone to develop skin cancer, and the media can sometimes be guilty of promoting a tan complexion as a healthy complexion, and this can promote the use of solariums and young people sunbaking outside. We also live in a country that has a warm climate, that has a great affection for the beach and surfing, and sometimes this can predispose people to staying in the sun for too long. There is also a tendency for adolescents to wear clothing that offers little protection, and sometimes trends and fashion may impact on what adolescents wear. Males are more likely to develop melanoma, and this could have something to do with the fact that males are more likely to be outdoors, doing physical activity, the statistics suggest, so that may play a role in that. There's also been a lot of education around medical checkups and screening, and this may have encouraged people to seek help, seek assistance. There are a lot of media campaigns that have promoted this, so people just getting more checkups. It's become more the norm in our society. There's also the skin type chart here, which suggests that some cultures are more susceptible. So those that have fair skin, light eyes, freckly skin, are generally at greater risk, and that can determine someone's tendency to develop skin cancer, and that is linked to your nationality and your culture in general. The socioeconomic determinants of skin cancer include being in an occupation that leads to greater outdoor exposure, and often jobs with lower salaries and lower levels of education generally are outside, and that can lead to workers taking risks and not wearing protective clothing. Some of the environmental factors for skin cancer include living in an area that's closer to the equator. Australia experiences some of the highest UV levels in the world because we are closer to the equator. The Earth's orbit also brings countries in the southern hemisphere, which includes Australia, closer to the sun in summertime than countries in the northern hemisphere during summer. So clearly Australia is at greater risk than other countries, and we do have a very high rate of skin cancer compared to other countries. So if you're living in an area such as Brisbane or Darwin, you are getting high levels of UV radiation due to your proximity to the equator. Also, greater outdoor exposure in rural and remote areas due to occupations such as farming and agriculture may increase someone's likelihood of developing skin cancer. And also some workplaces or institutions that may or may not provide shade, whether it be natural or man-made, can also determine the risk of skin cancer. In terms of the groups at risk of skin cancer, males are twice as likely to develop melanoma, and they're 2.7 times more likely to die from melanoma. People aged 60 and over are also more likely to develop a melanoma or a skin cancer. Low SES due to labour-intensive occupations, which may be outdoors. People with fair skin, populations that are situated closer to the equator, people in outdoor occupations, people who spend too much time in the sun without protection, and of course children and adolescents are at risk because those first 15 years of life are crucial and can lead to skin cancer if someone has spent too much time in the sun over that time. Thank you very much for listening.